A coronavirus strain first detected in India is now confirmed in Canada. 39 cases in British Columbia and 1 in Quebec. Scientists are calling it a variant of interest, not a variant of concern at this point because they continue to study it. But they are investigating some of those key questions, whether it might be more contagious, potentially more dangerous, potentially less affected by vaccines. Concerns about the surge in cases sparked by variants have led to growing calls for tougher border rules, and we may see an announcement on that possibly today. As David Cochrane has been reporting this morning, the federal government looking at everything from new public health measures all the way to entry bans and travel restrictions, again, potentially as early as today. That's our starting point for the conversation this morning with Dr. Cora Constantinescu. She's a pediatric infectious diseases specialist with the Vaccine Hesitancy Clinic at the Alberta Children's Hospital, and she's in Calgary this morning. Good morning, Dr. Constantinescu.
Good morning.
There was my big preamble to tell you about this new variant. As I mentioned, the cases in 2 provinces. So in Canada, there is the variant that first emerged in the UK and also emerged in South Africa and in Brazil. But there is this new variant first detected in India, which is causing interest right now. What do we know about it scientifically so far?
Yeah, so you hear these 2 terms, Heather. One is variant of interest versus a variant of concern. A variant of interest means that there are mutations in the virus that gives it the potential to be more transmissible and to have more severe disease and potentially escape immunity, such as from vaccines or from previous COVID infection. And we're seeing that this B1617, which seems to have originated in India, is now this variant of interest. It has these mutations, seems to be more transmissible, at least by around 20%, and it seems to have the ability to escape some of the antibody responses seem to be lower by around 50%. Possibly not as transmissible and severe as what you said, the UK variant, the B117, and the South African, the B1351, but definitely something to watch for. And again, it outlines that as long as this virus spreads and it replicates, then it can mutate. It can cause these variants, and nobody's safe until the whole world gets this under control and gets vaccinated.
Which is why we watch what is happening in India with that explosion of cases. But they call this particular variant a double mutation, Dr. Constantinescu. What does that mean?
Yeah, you might have heard this. So it seems that it are 2 mutations in it that give it this ability to be more transmissible, to possibly escape some vaccine responses, and to be more severe. So it refers to the number of mutations that they're noticing.
So in response to that, as I was mentioning, Ottawa considering a number of things, everything from public health measure enhancements to travel restrictions. Is there anything from a medical perspective you favor on these variants at this point?
It's always not one size fits all on any of this. Public health measures are incredibly important. You remember earlier on when the variants were just starting, the number of days people had to isolate were different, so a bit longer around these variants. So there are going to be some extra public health measures in place, and potentially we might see a temporary travel restriction to some of these areas, more specific than a broader travel restriction, just until this gets figured out. But of course, this is all up to the government and the Health Agency of Canada to decide. It's always a combination of many things together that are going to get this under control.
Okay. There was some research yesterday in the New England Journal of Medicine. A couple of things I'd like to ask you about. Number one, we talk about vaccine and how effective it is with these new variants. There's something that the CDC has been looking at, the Centers for Disease Control. They're called breakthrough infections, when someone who has been vaccinated still gets sick anyway, as I understand it. And you've been looking at the research. I know we flagged that to you. It happens, but they're mild. What do you see in the research which is interesting?
Yeah, so these breakthrough cases are just like what you said. So these are cases where people have been vaccinated and yet they still get COVID-19, the disease. The number, and we knew that because we knew that no vaccine was going to be 100% perfect. However, the numbers are reassuringly small. So out of the US, they have about 5,800 cases in 77 million people that have been vaccinated. So very different, very small numbers. And overall, the effectiveness of the vaccine out of these numbers in the US seems to be over 90%. What's interesting about these breakthrough cases is that 2/3 of them seem to be asymptomatic, mostly mildly symptomatic. But there is one important but, and that is that in the initial clinical trials, the vaccine seemed to be 100% effective against severe disease and hospitalization and death, whereas this time we're actually seeing 7% of these breakthrough cases in the US having severe disease and hospitalization, and they've also seen some deaths. So this is a little bit different. Now, what they need to figure out is, are these variant cases? Is there something about these people's immune systems? Like, what are there certain factors that predispose people to getting these breakthrough cases and specifically getting the severe disease if they get the breakthrough cases? But overall, the numbers are reassuringly small, again, showing that these vaccines are effective.
Reassuringly, that's a good word for this next question, because also in the Journal yesterday, we've been reporting extensively on the concerning number of pregnant women who are in ICUs right now and very sick with COVID-19, and they're studying what the correlation is between COVID-19 and pregnancy, what the link might be. In the Journal yesterday, taking a look at the mRNA vaccines, so the Pfizer-BioNTech and the Moderna vaccines, and they don't appear to pose any serious risks during pregnancy. What does that tell us, Dr. Constantinescu?
So this is also reassuring. You're right. In the beginning, we knew that in the initial clinical trials, pregnant women were excluded. Now, there were some pregnant women that inadvertently did not know they were pregnant and were in the study, but the numbers were small. We're talking a couple of dozen in the initial clinical trials. Since then, we have seen over 70,000 women in the US pregnant, with a number of completed pregnancies that seem to have successfully completed pregnancies with no increased side effects from the vaccine than the general population. In this particular in this particular study, they looked at a special database where they had around 35,000 pregnant women, and of those, around 4,000, just under 4,000, had completed their pregnancy. And again, they did not see any increase in adverse events than the women who were not pregnant. Also, incredibly good news because, as you pointed out, pregnant women are harder hit in terms of ICU admissions and severe disease with COVID, and their babies cannot be protected with vaccines yet, and yet they're at higher risk of the disease as well. So very good news in terms of pregnancy and no increased adverse events. And it seems that in those studies, the number one adverse event was, just like in the general population, a sore arm.
Okay, well, that you can contend with. That's interesting. There is some discussion about whether pregnant women should move up on the priority list for vaccination, so perhaps falling into that consideration. One more question, because as we well know, your special area is vaccine hesitancy. There is a new hashtag out there which seems to be trending a lot, Dr. Constantinescu, hashtag vaccine selfies. Celebs, media people, politicians, former politicians. We're going to show you some from Canada. For example, you're seeing past and present. You're seeing Stephen Harper, you're seeing Catherine McKenna, you're seeing yesterday Jagmeet Singh, everybody posting pictures of themselves getting these shots. When a public figure does this, what effect does it have?
Yeah, I have to say that I love seeing people's pictures. And even before I had my vaccine, I had mine on Monday and I did not do a selfie. And I felt a bit disappointed that I didn't. So what we know about the vaccine hesitant is that they are much more likely to be influenced by their people in their social network. So that is people on their own social media, their friends, their family, the people who influence them have a much higher weight in terms of influence for the vaccine decision. So if you are seeing selfies of people in your social network, people you can identify with, people who are already influential to you, it is conceivable and in my mind makes sense that it's going to encourage and validate the vaccination decision for people.
Okay. Hey, we had 3 positive stories today. That was a nice change. I thought you'd appreciate the vaccine selfies in terms of reducing hesitancy, which is what you're so concerned with. We'll see you next time. Thanks a lot, Dr. Constantinescu.
Have a nice day.